Yes. So we have. Yes. So cuff assist. This is part B. So hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are conducting sessions for part B. Right. The trainer series, test 1. So reading episode 4, we have seen episodes 3 so far from part A. So part A, episode 1 is multiple choice questions. Part B, so fill in the blanks. Part C, short answer questions. So we have seen 3 episodes. So now we are going to see from 4th episode onwards. Right. So here it is. So now you will have 2 minutes. So you will have 2 minutes for the question. In the 2 minutes, you have to analyze and tell the answer. Afterwards, we'll discuss. Right. So after that, we are going to discuss Dr. Shams. Yeah, ready. So here we start. Here we go. Grandmaster class, cuff assist, multiple choice questions. Question number 1. Right. Now, you can tell me what is the answer. You can message what is the answer in the chat box. Okay. Right. Now, Let us check the answer. So the answer is B. The answer is B. Now let us analyze this one. Yes. So that's the point here. So the text explains that it is advisable start with the lower pressures to enable the patient to become accustomed to the feel of the device. So that's the point. Option B. So option A does not say that the patient is expected to operate it. So they do not need to be confident with the technique. Option C, the text says that face coverings, mask, mouthpiece, or the trachea mount should be appropriate, but it does not recommend that the user should ensure a correct fit for each patient. So he's not mentioning. So B is the right answer. So now let us analyze this particular question here. Let us analyze this particular question in a different angle. The first thing is, you should check what are the key words in the STEM question. So when first using cuff assist, first time, the guidelines recommend. Okay. So the keywords are, so there are some keywords here. When first using cuff assist. Okay. When first using cuff assist. Okay. The guidelines recommend. So first time you are using cuff assist. So when first using cuff assist, that is the first one. Then the guidelines recommend. So recommend is the most important word here. This is called the operating word. Okay, there are two options here. When first using cuff assist, that is one. And the guidelines recommend, that is another one. Okay, fine. Now, recommend what? The guidelines are recommending what? For the first time. For the first time. Okay, first time. Initially, that we can say. Right. Now, let's go to the three options. So recommend, so advise, recommend means advice or guideline. Okay. Now, what are the operating words in the three branch options? The branch options A, B, C. So first one is checking. The next one is giving. And third one is ensuring. Checking, giving, ensuring. So that the patient is confident. Patient is confident. Okay. So checking that the patient is confident with the technique. So checking the confidence level of the patient with the technique. Right. So this is regarding the technique. They're talking about the technique here. So the patient is confident with the technique or not. Technique. So patient is okay. Patient is 100% confident or not. So you are checking. So technique should be, he should be aware of the technique. Number one. So confident regarding the technique. Next, number B, giving chance to get used to the sensation it causes. So there is some sensation. It causes some sensation. So it causes some sensation. What? Cuff assist. It causes some sensation. So if he doesn't get used to it, he will not be comfortable. So the giving the patient a chance to get used means, so getting adjusted, getting used to the sensation. So sensation is the problem. First time, he will feel bad, maybe. He will feel wrong, maybe. He will feel uneasy, maybe. So the sensation is the problem here. First one, technique is the problem. If you are not confident, so he will not agree. He'll say no. Then if the sensation, so he is not used to the sensation, so in the future, he may not accept. So sensation, he has to adjust, accommodate, adjust or get used. Okay. First, anything is not very easy. We cannot get used to everything in the beginning. So gradually we'll get used. So the patient should be given a chance to adapt or adjust, get used to the sensation it causes, because it will definitely cause some sensation. So that he has to adjust to that or adapt to that. Okay, manage well, go along with the sensation. Next one, ensure that the face covering fits the patient correctly. Ensuring that the face covering fits the patient correctly. So now here, face covering. So this is the face covering. The face covering fits the patient correctly. So you have to make sure that it fits the patient correctly. So here, so it is the fitting of the face covering. So face covering is the problem. If it doesn't fit properly, maybe there is some problem. So you have to make sure of that it fits correctly. What fits correctly? Face covering. So here three options are there. Recommend the technique to be confident, recommend the sensation to be got used to, and fitting the face covering. So face covering, sensation, technique. These are the keywords here. Okay, these are the keywords here. The other words, there are three words in A: checking, confident. So the keywords I will underline now. So checking is one keyword, confident is another keyword, but technique is the operating word, main word. So checking what? Technique. Confident what? Technique. Patient is worried about what? Technique. So technique is more important here. And in the second one, giving, keyword, chance. Another keyword, get used. Another keyword. So these are the four keywords. Sensation. Okay. These are the four keywords. But sensation is more important here. This is focusing on sensation. Like first one is focusing on technique. And the third one is focusing on face covering. So nouns are very important mostly. Remember that. Nouns are more important than many other things. Right. So these are the three things that you have to see. Now, next one, connect the relationship of the operating word in the stem with those of the three branches. Now see there, operation A suggests focus on patient skill confidence regarding the technique. Skill confidence. So he's talking about the skill confidence. The option A is telling about focusing on the skill confidence. Right. Now, option B, it suggests letting the patient get used to sensation. Okay. Getting. So this skill confidence is not there in the text. So A, technique and skill confidence. So this confidence level is not there. It's not presented in the techniques. There is nowhere. He's telling that this patient should have the skill. The patient should have confidence level. Nowhere it is told. But he's telling, giving the patient a chance to get used to the sensation it causes. Get used. Get used means become accustomed to. Okay. To. Now here is the keyword. To. To. Become. Get. Accustomed. Used. Adapted. To. To. So you see, the sensation, the feel, it, the devices. Okay. So you try to understand. So patient, So you have to relate every word when you are getting the, so part B is a tough job. So the patient, to enable means enabling, means giving an opportunity. Enabling means to give an opportunity, a chance. Okay. It is advisable to start with lower pressures to enable the patient to become accustomed to. Okay. Give an opportunity. Enable to means give an opportunity. So to give a chance. Enable means help him get a chance. So now you understand this very clearly here. Okay. Everything is there. So this is how you are going to analyze this point. Then only you will get. Yeah. So giving to enable the patient a chance. So give a chance, enable, to get used to get means become, used means accustomed to sensation it causes of the device. Okay, right. So this is how everything is clearly fitted there. Okay, it causes, so to experience, that's what it is, to become accustomed. Okay, to get used to. So this is how you're going to find. So this point is there, but the technique adjusted, becoming confident to the technique, no, it's not given there. So he's talking about sensation. Sensation means the feel of. What do you feel? How do you feel? The feeling. Okay? The feeling when you use it. So he has to adjust. Now, next one. Third one, ensuring that the face covering fits the patient correctly. Face covering fits the patient correctly. So here, suggests ensuring fit of mask or mouthpiece. Text says appropriate interface. So here it is telling appropriate interface. So here it is there. Appropriate interface. So appropriate interface should be there. Okay. But not that it must fit correctly. He's not telling that it must fit correctly. Okay. Proper fitting must be ensured, means made sure. Compulsory. Nothing is there. Fix the circuit to the output, including a bacterial viral filter, smooth bore, tubing, and an appropriate interface. That's mask or mouthpiece or trick. But it should be fit properly. It's not there. Check the starting pressures, but check that it is fit. No. Check starting pressures or changes in pressure requirements. But he did not say that check whether it is fitting properly. He did not say that the fitting part he did not discuss. So technique he did not discuss at all. That fitting also he did not discuss at all. So appropriate interface is there, that is face covering is there, but fit the patient correctly. Exactly it should fit. That is not given. Appropriate interface is there. Okay. But proper fitting of the appropriate interface is not there. So and he did not say that you must make sure that it is correctly fit. No. Correct fitting, you should make sure. He is not saying ensure means make sure. Confirm that it is properly fitted. No, he's not talking about that. So here you can understand very clearly that A is ruled out. A is ruled out. So if you want to know that the answer is right, you have to verify with each and every option here. So it causes, so he feels. It causes. So he is feeling, it is causing something, so he is feeling. So the last word also here. So it is causing something, he is feeling. It is causing, it is resulting in some feeling. This cause is the result, the feeling of the device. Okay. So every word is related there. Okay. Every word is related there. But the main word technique, face covering is there, but fitting correctly is not there. Technique, confidence, both are not there. So be very careful when you are explained these answers like this. Yes, Shams, Dr. Shams, is it clear? Yeah, you can unmute.
Mm,
Any doubt?
uh,
Is it clear perfectly?
yes, yes, yeah,
Yeah. So what do you learn here? You should learn that every particle or every word or vocabulary should be one way or the other way. It should match with the text perfectly, 100%, right?
yes.
So that you have to verify. Once it is clear, then everything is done. Okay?
Mm, yeah, yeah. It's very clear and helpful.
Yeah, so this is how you have to relate the question here. You have to relate the question in a proper manner. So, how are you going to relate? For example, let us see some options will fit 100% right. That means every word will be matching. Every word will be matching. Whereas some they don't match at all. For example, say, option A, technique is not matching, confident is not matching, checking necessary, nothing is there in the part. Then second one, 100% every word to word is presented in a different way. For example, get used to means accustomed. Get means become. Okay. Become used to. Okay. To become used to or to get used to. Accustomed means used to. Right. Sensation means feel. It means the device. Okay. So to enable means give an opportunity. Okay. A chance. Opportunity means chance. To enable means give a chance, give an opportunity. That's the meaning. So in this way, you have to realize. So now, so that is how. So here now you can analyze these points here. The text explains that it is advisable to start with lower pressures to enable the patient to become accustomed to the feel of the device. Okay, the feel of the device means sensation. Feel means sensation of this device. So option A, it does not say that the patient is expected to operate it. So patient is not going to operate. So why he needs to be confident? Because the nurse is going to show him. So in the beginning itself, you cannot expect the patient to operate it in the beginning because it's totally new. So that is ruled out. A is ruled out. C, option C, the text says that face coverings, that is there. It should be appropriate, but it does not recommend that the user should ensure a correct fit for each patient. So every patient should be correctly fit. No, it's not mentioned there. Appropriate face covering, that is there, but that
Hello, Varunika? Disconnect.
There was a network problem, so I could not get the network. So no worries. We are going to start. We are going to start the session. So, right. So there was network disruption. So we finished one point. That is question number 1 is done. Now we'll go for question number 2. We'll go for question number 2. Right. Yeah. Next one is 5th one. Immunoglobulins. Yeah. Immunoglobulins. Yeah. So there is no electricity. I'm using my mobile network. So Just bear with me. Right.